Hello, everybody, and welcome to the show. This episode is brought to you by The Wellness Paradigm, a holistic health coaching company that's shifting the way women understand and heal their bodies. Through bioenergetic testing, functional lab testing, and functional nutrition, we uncover what traditional approaches often overlook. So you can stop guessing, start healing, and finally feel like yourself again. No more one size fits all approach, just real answers, deep rooted healing, and the clarity and confidence you deserve to feel incredible. It's time to shift the paradigm of women's health. Now, on to the show. Hello, hello, Sam. I'm so glad you're here.
I'm so glad to be here.
We are going to get into some really fun topics with Sam. Sam is a doctor of physical therapy and a women's pain relief specialist, and she really helps women optimize their performance without medications or surgeries. And I'm really excited to kind of dive into your story, what you do, how you help, and just kind of the different approach you take with, clients, especially ones that come to you with this very physical ailments, and how you help them. So I'm going to give the floor over to you.
Yeah, thanks so much for having me. So, when I was in high school, I was a three-sport athlete, eventually went on to play collegiate lacrosse. And while I was in high school, I I was in high school in 2012 to 2016. So that's when, Victoria's Secret models were the size of your pinky. So that's what I was chasing. And even though I was an athlete, I was under eating, overtraining. After lacrosse practice, I would go home and do ab exercises, or I would wake up before school, do HIIT, do abs. You know the story. I'm sure you did the same things.
100%. 100%.
So my journey really started with this disordered eating, disordered relationship with my body, with movement, with food. And it ended up leading to a lot of injury, a lot of pain in my body. I went to physical therapy, as one would, and it wasn't the worst experience in the world, but it definitely did not prepare me to get back to the athletic things that I wanted to be doing. So naturally, I was in and out of physical therapy all of the time. My ankles became literally like rubber bands. Like they had no stability. Between lacrosse, basketball, track, my ankles were just like jello, because I didn't have the strength. And I also didn't have the knowledge about how to build strength, both in the gym and outside of the gym. So I was inspired after high school to apply to physical therapy school and start to learn more about the body, pain, and injury, because it's what I had dealt with basically my whole athletic career. And I was actually very disappointed when I went to physical therapy school and there wasn't a ton of education on actual movement when we claim to be movement experts. Now, do I think physical therapy could do a better job? Yes and no. There's a lot to know when you become a doctor, and doing it in 6 years, it's kind of crunch time. So, and with physical therapy too, I don't think a lot of people know this, but there's a lot of different avenues that you could go down. You could be a cardiologist PT, you could be a pediatric PT, you could be a neurologic PT, you could be an orthopedic or a sports PT. There's many, many avenues, right? So we have to come out of school a general practitioner. However, to claim that we are movement experts and then not actually move our bodies ourselves or understand how to train ourselves, I think was a little backwards. So when COVID hit, I was still in school and I started to do my own research, got my CSCS, my strength and conditioning certification, started researching nutrition, started researching more on chronic pain and injuries, specifically in female athletes, and just came across all of these things about how we need a holistic approach, and there's not enough physical therapists doing that. Physical therapy only focusing on the physical when there's a lot of mental involved, when there's a lot of, the stress, the sleep, the nutrition, the hydration. So I started to develop my own theories on what was causing chronic pain and how we can get people out of pain. Pulled myself out of a chronic pain cycle, rebuilt my ankles. I also did have heart surgery at one point. No one taught me how to progress back to sport from that. They were just kind of like, yeah, you're clear to do whatever you want. Kind of like they do postpartum, right? Oh yeah, you're good, whatever you want to do. There's no evaluation, there's no helping you progress unless you spend a lot of money on an out-of-pocket pelvic floor physical therapist, which don't get me wrong, I'm doing right now through my pregnancy, but there's just a lot of holes in the system. And that's why I built my company, Unleashed Athletics, to help fill those holes and help active people get back to their active life without chronic pain and actually have that sustainable approach. I don't want them back in my office kind of thing.
I love that. I think it's so important to have this holistic approach as somebody who dealt with chronic pain for 2 decades, 3 decades, really. I was in and out of physical therapy forever. I thought I wanted to be a physical therapist, and then I learned more and worked at a company. Oh, no, this insurance. I wanted to be
Mhm.
on the like proactive side, not the reactive side of things. You know.
But that's healthcare. Like I just spoke about this at the North Carolina Physical Therapy Conclave this weekend
Mm.
about how healthcare is reactive and not proactive. And that's the approach that we take is we try to be a lot, even though a lot of people come to us with chronic pain, we try to teach them more of those proactive approaches. But that's exactly right. And that's why I couldn't stay in person because it was reactive. Insurance is dictating what you do, not you.
Yeah, and it's hard because okay, you look at a knee, but that knee might be, an ab issue, might be a motion issue, might be an inflammatory issue, but you can only really do the exercises that insurance will cover for that knee. And, maybe that got a little better, sure, but it's not going to always be the full picture until something else kind of happens too, right? Like, wait a minute, why did my hip? Why did my shoulder, whatever, right? It's all interconnected.
Mhm.
And I know a big thing that maybe you can tap on is like when I was going through all this, nothing helped. I mean, I was in and out of doctor's office like a full-time job for about 5 years I have ankylosing spondylitis. And, nothing helped until I addressed my gut health, until I addressed my stress, until I addressed my internal health because my inflammation was so rampant
Mhm.
that nothing helped in PT. And it made sense, right? But I was just trying so hard. I didn't know another way at the time. Nobody knows. Okay, well, you're in pain. Boom, here's a script, right? So let's dive down that rabbit hole a little bit.
Yeah, there's a lot of research to support inflammation's connection to pain.
Hmm.
And, we live in a world where there's a lot more self and society imposed stressors than there used to be.
Yep.
And we know that chronic stress leads to chronic inflammation. And from a very sciencey standpoint of things, chronic inflammation expresses certain hormones, certain interleukins, certain genes that choose to express or suppress pain.
Mm.
So, when we have chronic inflammation in the body, we are more likely to experience pain because now our pain threshold has actually been reduced. So, people who say, "Oh, I have a low tolerance to pain," or "I have a high tolerance to pain," that's really a neurological response that you can change through repeated exposure. So, that's a lot of what we do with our athletes is one of the things we do address for chronic inflammation is we look at the diet and we introduce an anti-inflammatory diet, taking a little bit more of a Mediterranean approach. We don't tell our clients they can't have any types of food, but we encourage increased consumption of whole foods, berries, red meats, reduced consumption of dairy and gluten, whatever that looks like for them, reduced consumption of alcohol. Again, we don't tell them no, but we provide the education on how it's inflammatory. Your body's probably already in an inflamed state. And chronic pain is anything that's been more than 3 months. So after 3 months, the injury's healed. The reason why you're still feeling pain is because inflammation has hung out.
Mm.
And that's what's, again, expressing these genes, these hormones that are causing you to have that increased pain. So not only are we now working with the diet, but we're also working to reduce stress and we're working to reduce fear around movement through that repeated exposure. So maybe, yes, squatting bothers your knee. Your doctor has told you, oh, then don't squat. Okay, how do you use the bathroom? How do you get into the car? How do you sit down to have dinner? You're going to squat throughout the day. We just have to figure out what your capacity looks like. Maybe right now it is body weight squats. Maybe we can just start with a wall sit to make you feel more comfortable. And then we gradually, you do the wall sit, however many times a week for however long, and then gradually increase the load in that movement. And that's how we start to reduce the fear around movement, which reduces stress, combined with a diet that is high in nutrients, protein, and not, high in uh, fatty oils or sugars or processed foods that are going to increase inflammation. Now we can actually get a reduced inflammatory response in the body, get you to trust your body a little bit more, start to load the tissues, which then changes the tissues and causes you to actually heal and reduce the pain for good and get back to doing what you love. Not just, traditional PT, pain's gone, good. Like you're walking without a limp, all right, you're good. See you later.
Yep.
But here we don't do that. Getting out of pain isn't good enough for us. We want you to now go run the marathon you want to do, or compete in the high rocks competition or the weightlifting competition, whatever it is that looks like for them.
Yeah, I mean, it's so different between, being quotation out of pain enough to, dismiss you or, graduate from PT and living an optimal life, right?
Yeah.
Because I think it's also, you're not going to always get a script because your body aches and cracks here and there. You're going to get a script when your, ACL goes out, right? And that's very different, right? And
Yeah.
I think, would you agree that a lot of people that come to you and then they go through your program, they realize how much chronic pain and inflammation they did have because they were just maybe ignoring it or thought that it was normal?
Yes. So there's a lot of the times they'll say, "Oh, I have an ache in my knee. Sometimes my shoulder bothers me, and I can't turn my head this way." And again, when we see multiple joints being affected, it's not a knee issue, it's not a shoulder issue, it's not a neck issue. That's a body issue. It's either inflammation, it's either you don't feel safe in your body,
Mm.
or there's something else going on. Maybe there's just not enough strength. Like a lot of the times we just see weakness is expressed as pain because neurologically what the brain wants to do is protect us. So when the brain detects weakness or vulnerability, it will send pain or tension signals. That's why a lot of people say, "Oh, my hamstrings are tight." They're actually weak, and your body's protecting you from moving that body part because it is fearful that if you do, you could get hurt. It's your brain's just trying to protect you. So if we build strength, we have a really good shot at reducing that pain response because now the body feels safe enough.
I love that. And I think that's a really good kind of paradigm shift for people. And it might blow their mind when they're like, wait, I've identified as having chronic hamstring issues and chronic tight, and then you rock their world and you're like, actually, one, it's weak, and two, there's a lot of safety around this, and three, you probably have some emotions and probably some like chronic inflammation, and you probably have some mineral depletion. So it's like once you handle all of those things, suddenly they're better after years, years of trial and error, right?
Yeah, people are like mind blown that I've helped women who have been in pain for 7+ years get out of pain in 4 months. And I'm not magic. Like, I don't have a magic touch. I'm not a witch. Like, I just know how to find the root cause of the pain that hasn't been addressed before. And I don't believe it's the practitioner's fault. Like, I don't
Yeah.
believe that physical therapists are out here like not doing their due diligence, or chiropractors are not out here doing their due diligence. It's a systematic issue where there's not enough time. And there's a burnout in our industry
Mhm.
is such a problem.
Mhm.
And that's why I actually started offering like mentorship for physical therapy students, physical therapists who want to get out of the matrix because they're so burned out that they can't provide the care that they need to their patients for their patients to get better.
I have seen, I mean, when I was going to go through physical therapy school too, I didn't see really a lot of happy people like fulfilled, and that was a weird thing even when I was younger and didn't really quite understand alignment and energetics the way I do now. But I was
Mhm.
like, everyone looks kind of miserable. It's kind of just like it's almost like a system. It's like you're in, you're out, how many more people can we get in? Oh, insurance, blah, blah, blah. And it didn't feel whole, you know?
Mhm.
And it's not, I love what you said, it's not anybody's fault because we are all part of a system, right? Like part of a care plan. Your doctor might have some medication, that's great. Your nutritionist might be able to support you, on the physical level. You have maybe a therapist, that works on an emotional level, and maybe a physical therapist who can help blend all of these things together. But it's not that, I see so many people in our world that get mad. They're like, that person didn't do anything for me. They didn't it's like, well, how many physical therapists know about emotion, right? How many,
We're not really
therapists know about
taught.
nutrition, right? It's not necessarily, we all have our own specialties and it's finding that care plan that's going to work, the best for you. you know?
Yeah, and we're not really taught that in physical therapy school either. Like I said, we have to come out a general practitioner. Do we have psychology? Yes. Do we have some nutrition? Yes. Is it adequate enough for us to be able to actually impact our patients on that deep of a level? No, but I don't think that that's necessarily school's fault either. I
Oh,
mean, there's something like the system isn't whole yet, and I think that they have yet to figure out, because the thing is then you'd have to add like another year to school. Well, like we already
yes.
go to school for 6 to 7 years, so how long is school going to end up being, right? So how to fix the problem, I don't know. You might just have to do what I did after school, go and do your own research, your own knowledge, hire a mentor and figure out how to do this other route. But we're not taught that in school. So it's not physical therapists' fault that they're not, like, we're taught the biopsychosocial model, but actual implementation, not there. Right. When we know research time and time again shows us how our thoughts actually shape how we heal, but I don't think that's driven home enough in PT school for us to actually apply. Because I didn't really start applying that till I left in person and was doing more of my own research, and even just through experience and working with patients. And like going back to the knee that you mentioned before, like, yeah, if you have a knee pain, it's not necessarily a knee issue. It could even just be that you have a history of knee replacements in your family. So you think that you were doomed for a knee replacement. So now you're expecting it. So
Yeah.
now you go for a run, you feel a tweak in your knee, and now you make it out to be more than it is. So you stop running because you think that it's going to cause you to have a knee replacement further on down the road.
Yeah.
So now you pull yourself out of the thing that you love, you stop training your body, your pain gets worse because now you're sedentary and you're thinking about it all the time.
Mm-hmm.
But you don't actually need that knee replacement. What you need is potentially a strength program to go along with the running to help your capacity there. But that's where mindset plays a really big role in pain and injury, and even like whether or not you get surgery sometimes.
Oh yes. Oh yes. The mind is incredible. And I do think that in the last 5, 10-ish years, more data has been coming out because
Mhm.
especially, when you become a doctor, it's very data driven, right? And
Yeah.
sometimes when you deal with the emotional or energetic side, it's not as quotation well research per se, even
Yeah.
though you and I have probably seen the most benefits off of, people actually implementing that. So I would love to hear more about how I also think being online, you can
Mhm.
do more, and in person, it's just you're put in a box, how many minutes you have per client.
Yep.
You can only get so much done. And so online, I love like when I'm transitioning online, it was a whole new where I could do so much more with clients, and dive into that emotional stuff. And more people are receptive to it, you know?
Yeah, and you're able to take that time, like when you're in person, say a patient walks in and they have some new ailment that day, or something developed over the weekend, or they are not in the mental capacity to handle rehab right now.
Mhm.
I only have 20, 25 minutes with you. I don't have time to address the mental capacity. I don't have time to think about what happened over the weekend. I don't have time to think about your new diagnosis, because now this happened so many times in clinic where patient with knee pain walked in now with calf pain. Are they probably connected? Yes. I didn't have time to do a whole new full eval on you because I have another patient in 20 minutes.
Yep.
So that's where online I could actually take a pause. Athlete can come to me with some new ailment and I can say, thank you for the information. Let me digest. Let me go back to my notes. Let me do some research. I'm not entirely sure right now.
Hmm.
But you can't do that in person because it's right there, right now.
Hmm.
And then you're like, okay, I'll do it for next session. Naturally, you forget or you run out of time because you have notes to write, you have doctors to call, you have insurance
Hmm.
companies to speak to, you have 40 other patients to think about.
Hmm.
So that's why the online space, I know a lot of people are skeptical about online physical therapy, but
Yep.
because there's no manual therapy. And I'm like, manual therapy doesn't even have long-term benefits.
Yeah.
Short-term, yes, it's beneficial for some patients. Yes, I actually recommend some of our athletes go to Chiro, go to PT, get some manual. But those are the short term. The long term is in what I do.
Hmm.
And we just have that greater capacity online.
And that blend too, right? It's not an either or. It can be an and, right?
Yeah.
It doesn't have to be you have to do this one modality or this one. Um, I do want to tap a little bit on, you mentioned like the emotional side.
Mhm.
What do you feel is kind of the biggest thing that most athletes or women that you work with kind of come in with, and how do you help kind of move them through that?
A lot of them come in with some kind of diagnosis.
Mhm.
Um, I don't know how this happened, but well, I mean, I have a hip labral tear myself, but I feel like I didn't speak on it a lot on my social media. And then all of a sudden, I had all of these women with hip labral tears come and
Interesting.
work with me. And first line of treatment, well, not first line, but what they want to do for a hip labral tear because they want to fix it is surgery. And
Mm,
yes, that fixing the hip labrum, the only way to do it is through surgery. Again, I'm not magic. I'm not a witch. I'm not going to
mhm,
heal your hip labrum. But odds are the hip labrum is not the reason you're in pain. What happens when you have a tear in the hip labrum or the shoulder or any other area where there's maybe lack of laxity, maybe you have a ligament sprain, something like that, we're losing stability at that joint. So what we need to do is increase stability. Again, it's a neurological response. You have pain there because it's unstable and your brain is saying, oh, it's not safe, let me send pain so we don't move it. But the
mhm,
hip labrum tear does not actually cause the pain. It's that neurological response. So what we need to do is build strength to build stability.
mm.
Same thing, they come in with a herniated disc, right? So they come in with these diagnoses and they identify with the diagnoses.
Identify.
I
Yep.
just had this one athlete who she didn't come in with a disc issue, but she had been told she had a lower back injury. And that enough was enough for her to say, okay, I'm injured. I shouldn't move my body this way anymore, or I can't move my body this way anymore.
Mhm.
So we have to pull them out of this identifying with the diagnosis and instead show them the opportunity. So we have athletes that come with diagnoses, not that we completely don't care and dismiss it, but we write it down, we take note of it, but we don't use it when we're formulating our plan for them. Instead, we do a lifestyle audit. We take a look at a day in their life, stress levels, sleep, hydration, nutrition. We take a look at their mobility. And if it's appropriate, we also take a look at their strength. Okay, so I had this one athlete who came in thinking, she said, I had a lower back injury. And so she's identified with that. And again, we take these diagnoses into account, but we don't let them formulate our plan. So instead, we take a look at their full day, their nutrition, stress levels, sleep, hydration. We take that into account. And then we also take a look at their mobility and their strength.
Mhm.
And we use all of that to formulate what we call a functional diagnosis.
Mm.
And that's where the plan comes from. So now we're going to build them a mobility and a strength plan along with other protocols like nutrition, sleep, stress, hydration, whatever's appropriate for them, whatever other area of life. Oftentimes, it's not just pain and physical, there's something else going on in their life or in their health that feels not right now. So we'll formulate those protocols for them based on what we found before. Um, and because of that, I had this athlete who came in, she had a lower back injury. She said, I can't deadlift, I can't do this anymore. She's back to deadlifting. And she sent me a message the other day saying, I used to think that I had a lower back injury. And now I just feel like my back hurts sometimes, but the more that I move and strengthen, the better I feel. That mindset shift was necessary to get her out of pain. But a lot of the times we have to get them to see that, like seeing is believing. But
Mhm.
that shift in mindset from I have a lower back injury to I have lower back pain sometimes was huge for her recovery.
Yeah, I love that. I think so often we identify with our diagnosis and we make that our whole identity, and it shifts everything for us. And I see that a lot with, my clients with autoimmune issues and or any issues. I mean, I had three bulging discs, a thoracic outlet syndrome, SI joint fusion, an extra vertebra in my spine, like all these fun things. But it's like,
Yeah.
oh, and like I think a Buford complex in my shoulder. Yeah, I mean, it's just like all the fun things. But it's like if I went in identifying with every single thing and saying, well, I can't work out, that's what I was told. Well, you're not going to be able to work out ever again. I went from winning a bodybuilding show to being crippled, walking with a cane, and to be told, like, oh, well, you know what? You had a good run. You're
Yeah.
screwed now because now you have this diagnosis. And it's like, wait, no, no, no. That diagnosis is important. It helped me, to figure out what was going on. And if I had just identified with that and never done anything else, I literally would be crippled on a medical system that would take advantage of me and just pump me with medication my whole life, saying that was the
Exactly.
cure. Not saying that's bad for the record, anybody listening. It saved me in its time and place. But, can you speak a little on that emotional side of things on when people come in feeling, I want to say like a little helpless, disappointed, feeling like especially athletes, right? I was a professional dancer and athlete. It was like, you feel like the best is behind me. I can never be that way again.
Yeah, for sure. Um, there's a really big, like you said, when you're an athlete and you're told you can't do this anymore, you part of another identity of yours is now stripped from you. So now when you're a runner and you're told you can't run anymore, you lose part of yourself.
Yeah.
And that's really hard. So now on top of being in real physical pain, it's now exacerbated by the stress and the anxiety of you not being able to do the thing that you feel like you were put on this very earth to do,
Yep.
that gives you a sense of purpose, a sense of community, a sense of empowerment. And again, you're told, don't do it, don't do this, you can't do this. And it wreaks havoc on our nervous system. So instead, like I mentioned before, we find that minimum effective dose for our athletes. Sometimes, yes, it's appropriate to pull you from running and lifting heavy. However, only for a time being. It's not forever. And how do we still get you moving like you're an athlete so you can still feel a little bit like you can still get that same feeling that you were getting from running or lifting heavy without exacerbating your issues? So for someone who's a runner, maybe, yeah, running's off the table right now. Let's add in a progressive walking program. Let's add in some biking. And let's add in some strength work that will better prepare you for when you go back to running. So now the person stays feeling like an athlete. And then when we can bring back running, their body's better prepared to now handle that load. There's decreased risk of injury, there's improved performance, and an improved sense of self-worth and empowerment because you just got through that. So that's how we operate. We don't say you'll never be able to do this again or you can't do this. We're very careful with our words. Right now, we're going to pull back on running and ramp up some of this stuff that we think you need so that we're not telling them you can't do this. This is not possible for you. We're giving them the possibility, but showing them it has to be a little bit later down the road. And then when they experience that delayed gratification instead of instant, it really gives you a greater sense of discipline and carries through in multiple areas of your life, knowing that you can get through hard things and see something greater on the other side.
Mm, I love that. I feel like that's kind of a nice place to, tie this off too. And I think if you could, give a word of advice to somebody that maybe is struggling with a little bit of pain, trying to search for the next alternative, what would you tell them?
I would say just don't give up, get multiple opinions,
Hmm.
and honestly don't stop until you hear what you want to hear.
Yeah.
Like if running or lifting or doing something that somebody has told you you can't do is part of what you feel is your identity and your purpose here, don't give up until you find someone who believes in that dream too. Because I promise you it's out there. I promise you there's a route. There's something that can be done. So don't give up on the first No. Keep
Hmm.
going, keep searching for answers, continue advocating for yourself. Unfortunately, in the healthcare world, you have to be your biggest advocate. Your doctors are not always going to be that. And again, it's not their fault. They have 100 other patients to be
Yep.
worried about, that
Yep.
they don't have the time and energy to pour into you, but you do. So
Yep.
you have to be your greatest advocate. And if you really have tried everything and you feel lost, message me on Instagram.
Yes, tell us where to find you.
Yeah, I'm Doxyam Fit on Instagram. I honestly am not really on any other platforms. I've done a bunch of other podcasts. If you search Sam Kwieraga, that's my last name. There's a bunch of podcasts on Spotify that I've been on. But honestly, I'm mostly on Instagram, so just follow me over there.
I will link your Instagram down in the show notes so people can find you. And
Great, thank you so
thank
much.
you so much for coming on the show. If you guys found this helpful, whether for yourself, somebody that you know is maybe going through this, I would love for you to share it with them, or just put a comment down below if you found that this was helpful. I love to hear what resonates really well with people, and hopefully get a glimmer of hope. And so, thank you guys for listening, and I'll see you guys on the next show. Bye, Sam.
Thanks for having me.